All right, hi everyone. My name is Monica. Thank you for attending my poster presentation on the efficacy of journaling in the management of mental illness, a systematic review and meta-analysis. So I'm just going to get started with some stats. Death by suicide is about 50% higher in Alberta in comparison to other Canadian provinces. And in 2017 alone, there were about 10,000 hospital stays in Calgary for mental health concerns. So it's safe to say that we're experiencing a growing mental health crisis and alternative and sustainable treatment options need to be explored. So why did we do the study? Now, journaling is a widely used tool in psychotherapy, and anecdotally speaking, we know it works, but there have been limited efforts to systematically review the topic in the Canadian context, and there's no literature towards informing its use in the practice of family medicine. So I'll let you guys take a look at my poster for all of my objectives, rationale, methods, and all that good stuff, but I did want to go over some key results and conclusions in this video. So we did do a strength of recommendations taxonomy analysis on all the papers as a whole included in this review. And the findings were that all the papers as a whole comprise a B level recommendation. And all that means is that the data is inconsistent and or of limited quality. And as for our stats, we did our statistical analysis in two ways. We did a Cohen's d effect size analysis as well as our meta-analysis. So as per Cohen's d effect size, the majority of the studies included in this review showed a small to moderate effect size as a result of a journaling intervention. But interestingly, when we look at a meta-analysis done by Fournier and colleagues in 2010 on the efficacy of antidepressants in the treatment of mental illness, the same results come up. And then as for our meta-analysis, we found a significant 5% reduction in patient health scores as a result of the intervention. And although it's unlikely that this finding reaches clinical significance, it does indicate that journaling is overall an effective tool in the treatment of mental illness. And I additionally want to stress that our statistical findings are not necessarily reflective of the efficacy of journaling, rather it's due to the poor study quality. And despite the low quality of the data, journaling is a low-risk, cost-efficient intervention which builds self-efficacy, and there's no harm in utilizing this tool in the practice of family medicine. We believe that journaling is a powerful and effective tool, and we just need higher quality studies to be conducted in the future to demonstrate this. Thank you so much for attending my poster presentation.